Good morning, ladies and gentlemen. Welcome to day one of I'm Data 2022, Innovative Methods with Data Science and Artificial Intelligence. My name is Saline, and I will be your Master of Ceremony for today. I feel honored to be part of this big event. As we know, I'm Data is an annual international multi-track data science conference for data scientists, machine learning engineers, analysts, data science managers, and C-level decision makers. And for this year at IM Data 2022, the topic will be about NFTs, crypto, AI, Web3, and data science. This year's conference is unlike the previous ones. After 3 years of growing AM Data conference, we are bringing something even better this year. We have taken a step further to collaborate with Data ConLA, the largest data conference in Southern California, and featuring Indonesian speakers presented by Narasio Data. This will be an outstanding event. So, before starting this event, there are some points to keep in mind. First, set your username according to the name on the registration form and turn off the microphone during the event. You can ask questions via Slido while Zoom chat is only used for interactions with the committee. Your question will be answered by Narasio Data team via Zoom chat or directly by the speakers during the Q&A session. You will get an e-certificate if you follow today's event until the end and fill out the feedback form. Open your camera and use the provided virtual background in the photo session. And last but not least, today's event is divided into 2 sessions. The second session will start at 10:45 a.m. the Western Indonesian time, sharp after break time. You can submit your questions via Slido, scan this barcode, or click the link in the Zoom chat. All right, without further ado, let's start this event with welcoming speeches. Firstly, we would like to invite the representative of RMDS Lab, the head of IM Data Conference. Please welcome Mr. Vincent Chen.
Hi, thank you. This is Vincent, data scientist from IMDS Lab, who is hosting the IM Data Conference 2022 in USC. Starting in 2019, IMDS Lab has hosted a couple of great IM Data conferences. We are excited to have our IM Data Conference 2022 hosted in person at USC this year, just this Sunday, August 14th. We are hosting 3 tracks of speeches, which are innovative methods with data science and AI and Web3 in industrial practices, NFT, and the future of cryptocurrency. A total of 25 hybrid speeches, hosting the largest data conference in South California. We have received a lot of help from the Narasio Data Conference site, and we wish this conference could be run very successful, as we will in Sunday. We have some remote sessions hosted from 4 to 5 p.m. on Sunday, which I believe would be at 6 to 7 a.m. in the morning in Indonesia. So if you're interested, welcome to join any sessions during the time you like. And for now, let's celebrate and enjoy the Narasio Data Conference. Thank you.
Thank you, Mr. Vincent Chen. Hold on, we still have one more person. She will also share a little more about today's event as well as moderating the event. Please welcome the Chief Business Officer and founder of Narasio Data, Ms. Lita Hendranata.
Thank you, Celine, for the introduction. Thank you also, Vincent, for organizing this whole conference. We are so honored to partner with RMDS in hosting the IM Data Conference 2022 for Indonesian audience. As mentioned, my name is Lita Hendranata. I'm a founder and Chief Business Officer of Narasio Data. We are a data ecosystem accelerator where our goal is helping professional and institutions in accelerating data-driven transformation. We have done several programs So we have, as part of our program is consulting, we also have various training in data, such as data scientists, data analysts, data engineers, and our latest program is data science for accounting people. In addition, we also have internship program and job connector. The goal that we have is all Indonesians can have a data literacy by 2025. And today, as mentioned by Sally, I will also act as moderator for this event. Without further ado, I would like to introduce our speaker for today. We are honored to have Mr. Daniel Oscar Baskoro. He is currently served as Chief Operating Officer of from Ministry of Health of Indonesia for the Office of Digital Transformation Office. Mr. Oscar has so many achievements. Hi, Mr. Oscar. Good morning.
Hi, good morning, Lisa.
Good morning. Yeah, he has plenty of achievement, even though he's still very young. Congratulations on your marriage recently. Congratulations.
Yes, okay.
Yeah.
Yes, thank you so much.
So let me give you guys a brief intro of who he is. He's an awesome speaker. He is a researcher. He got his bachelor's degree in computer science from Gadjah Mada University. He also completed professional program in technology innovation from MIT. He also graduated Master of Science in Technology Management with summa cum laude from Columbia University in New York. He also obtained many awards, such as Innovation Global Winner in London, UK by World Bank, one of the inspirational young leader from United Nations, Best Public Safety Innovator in Silicon Valley, United States, Champion winner from ITU, Switzerland in 2018. The government of Indonesia also awarded him as the most outstanding youth in 2018. And in 2020, Oscar also received award as the first winner in Public Policy Dean Challenge in New York, United States. Currently, as I mentioned earlier, he served as a Chief Operating Officer from Ministry of Health Indonesia, but previously he served as AI Head of Open Government Indonesia, and he also have working experience in United Nations focusing on digital transformation. In addition to that, he has served as consultant, advisor, and commissioner in many different entities such as USAID, UNDP, One Republic of Indonesia, and Asia Digital Bank. So many accomplishments, Mr. Oscar. We would like to hear your story, how you accomplished so much in such a young age. And we are so honored and so blessed to have you bringing Indonesia in transforming the health. So good morning, Mr. Oscar. The platform is yours.
Yes, thank you so much, Lisa, for the introduction and for moderating the session. And so, hello everyone, good morning from Indonesia, and good afternoon also from other side of the world. So, my name is Oscar, as a Chief Operating Officer at the Digital Transformation Office, Ministry of Health. So, today I will give some presentation here related to the topic that already mentioned by the committee about the utilization of the data during the pandemic. So actually, this is very interesting discussion and also very relevant topic with current situation about how we utilize the technology, how we use the data, how we use the machine learning to solve the issue related to the pandemic. So I will present my slide here. So I will share my screen directly, Lita, from my computer.
You will share directly, okay.
Okay. Yes. So the topic is about implementing the data-driven policy for handling COVID-19 pandemic and beyond. So my presentation is not only about how we use the data during pandemic, but I also will share some strategy, some plan, how we use the data beyond the pandemic. And before going on the strategy and going on about the product and services that we are developed during the pandemic situation, I want to inform about some challenges and also the condition related to the digital health technology in Indonesia. So currently, the biggest challenge about the technology, implementing technology in Indonesia, is not only about the technical aspect, but the mostly is about the management, about the governance. Why is it happened? Is because we currently have 400 apps in the health sector, in the national, in the central government level, and because of that, because of that challenge, so the government, the health officer, very difficult to input the data, to use the system, because the system not efficient. We have a lot of apps, we have so many apps. Another challenge also is about the standardization. We have 400 apps, but most of the apps is not standard. So that's the biggest challenge during the pandemic situation. So the system is there, the computer is there in the health facility, but we don't have the simplification, we have the efficiency on the app. So that's the biggest challenge that we are facing during the pandemic. So based on that challenge, we see that the pandemic situation having a good opportunity to solve the issue. So we see that three aspects. The pandemic situation show that the importance of the health sector resilience. And the second one, the health system in Indonesia is available to integrate with the technology. The technology is there. And the third one is the collaboration between the private industry, between the public sector is there. So this is the key, the opportunities that we see, that the possibility that we can use to solve the issue using the technology during the pandemic situation. And in the last year, the Ministry of Health Republic of Indonesia, the new minister, the Minister Budi, developed a new team, the Digital Transformation Office. So this Digital Transformation Office is a team that specializes on the digital transformation in the health sector. So this is a new team just built last year, and currently we have 200 officers in the team. So, but that's still not enough. The challenge is still big. So 200 people in the digital team, but not enough to solve the issue. So we also have the group of the team that most of the team is engineer, also the operation side, also for the designer, from the user interface to the experience, and also from the administration, also operation. So that's the team that we have in the Ministry of Health to accelerate and also implementing the program of the digital transformation. And based on that challenge, based on the opportunity, and then also we have the team for digital health transformation, we also roll out the technology, the strategic transformation to handle the COVID-19 pandemic. So I will present some products, some services, and also some strategy, and also some solution that we provide during the COVID-19 pandemic. So the first one is about the Peduli Lindungi. This is the most famous government app, I think, in the current situation. I think most of the citizens in Indonesia using this Peduli Lindungi app, for the health protocol when entering the public space. So we have the Peduli Lindungi app rolled out in the 2020, and on the Digital Transformation Office, we finalized and also we redesigned, also we formulate the strategy to make sure the Peduli Lindungi can solve the issue and also can support the implementation of the pandemic response. And this in the Peduli Lindungi application, we implement some feature about the screening, about the electronic medical record, about the testing, about the vaccination, about the pet hospital availability, telemedicine, and digital operation. And the most important thing is about the user. I think this is the biggest app owned by the government in Indonesia. We have 100 million total users right now in the Peduli Lindungi, and average daily active users around 5 to 8 million. And in every day, the data that input by the system is around 400K data for the laboratory and 1.5 million data for the vaccination. You can see how big this, how big we manage the big data in Indonesia every day. 400K of the testing lab every day, or average around that, input by the laboratory every day, and also 1.5 million of data of the vaccination input by the health officer every day. So this is the important how we can utilize, and also here we can manage the data in the next way, and then also in the right mechanism. Because of what? Because we are managing a big data, and also this app is serving a million of people. If the data is not having a smooth process or a clean process, and also the accurate process, then will be the difficult process for the citizen. So this is the key how we manage the big data in Indonesia. Also, the important aspect also, we also put the ecosystem and the COVID-19 response together with the ecosystem with the industry. So we integrate the data with the main industry, from the government and so the startup, to make sure the data and also the services is integrated and people can use the services from the government easily. Because sometimes people that usually more comfortable using the app from the startup or more comfortable using the startup from the other system from the transportation, that's fine. But the system should be integrated with the our integrated platform. And also the interesting aspect also about responding to COVID-19 pandemic, we also have the mechanism to monitor the bed availability in the hospital. This is also the challenge during pandemic situation. When the case is increasing, and also that will be also important to have the availability on the bed hospital in the each of the hospital in Indonesia. So we also integrate the mechanism combining with the human verification process, combining with the chatbot, combining with the visualization to show the availability of the hospital. So we also collaborate with 2,000 volunteers that inputting the data every 3 hours. This is when we develop the solution on the COVID-19 pandemic. The most important things about the faster solution, not about the ideal solution. So when we design the strategy, that we are thinking the faster solution about the collaboration, the volunteer to input the data, and that's solve the issue. And this is the example when the health sector is very different. The faster solution is more important than having the ideal solution, and that's why we're combining with the human, combining with the chatbot, to having the good quality of the information to serve the citizen on the bed availability of the hospital during COVID-19 pandemic. And also the important thing also the integration of the data for the COVID-19 response on the self-isolation patient. On this solution, we provide free medicine packets for the self-isolation patient using the telemedicine. So we integrate the data from the laboratory. So once the citizen getting the result on the positive result on their lab result, and then the result will be directly sent by the chatbot to each of the patient. And then once the patient receives the WhatsApp about the eligible group to get the telemedicine, and then they can claim the telemedicine, and then they can receive the telemedicine for free and also get the free consultation for the telemedicine. So this is how we work with the ecosystem. So we integrate the data from laboratory, integrate the data from the telemedicine, and also integrate the data from the pharmacy unit to make sure we get the end-to-end services for the patient. Not only get the data about the report of the case of the patient, but also use the data from the report from the patient, from the laboratory patient, to give health services to the patient by using the automation. And this show a very, very positive feedback from the citizen. You can see on the TikTok that people show their medicine, show their consultation on the TikTok, that the citizen very satisfied with the services of the government. So this is the example we integrate the data and then get the certification from the citizen. Also for the pricing. For the COVID-19 pricing, this is one of the key of the COVID-19 pandemic. So I already told about the testing, about the treatment. This is also about the pricing. So also we integrate the data for the tracing with the military, with the health officer in the village. So once we get the positive case, and then the positive case can be reported to the village, and then they can trace who the close person, who the suspect from the positive case. So the data integrate real time. So because if I'm talking about the SLA, so the SLA is about 1 to 2 days. So we cannot trace the positive case on the next week. And then because that will be, the virus will be spreading. So we need to trace the positive case to the 1 day or 2 days next after the positive case detected. So this is the important about having the quick process to the data integration, because the officer, the military, the police can directly trace the close person with the positive case and then and isolate so the virus was spreading. So based on that data integration, we can improve the tracing ratio from the 1 to 1 to 1 to 15 in the 1 month because of the data integration. So this is the key. In the 1 year, the case tracing is only 1 to 1, 1 to 1. So one positive case only get 1 close person. And that's not comply with the standard of the WHO. But after we integrate all the data, all the ecosystem, we can get 1 to 50 close percent of the positive case, only 1 month. So this is example of how we combine the data integration and many process in the fields for COVID-19 vaccine. And also most important thing about the logistic process. So this is the usual process about 2 minutes about the availability of the vaccination, availability of the doctor, and many other aspects also to accelerate the vaccination progress in Indonesia. And also the important thing also, as a government, we also open our data. So we open all the data to the COVID-19 records in the aggregate format for the vaccination availability, vaccination coverage, vaccination achievement. We open all the data for the public, so public can see how the progress of the vaccination, how the current rate of the vaccination, so people can see about the current stage. And also the important thing is also about the assessment. In Indonesia, we have the level of the city or province related to COVID-19. So level 1 is the most level top of 4 is most not safe level for the COVID-19, because some of the assessments show that this is the dangerous because of the COVID-19 spreading. So we also have the assessment based on the data analytics, based also on the machine learning to identifying about the current situation on the city. So the policymaker can directly decide about the strategy about the response to COVID-19. We open all the data. So if we're asking how come my city become the level 2, and then they don't need to ask the government, they just need to open the dashboard and they can see why this happened on why the city is in the level 2, something like that. So this is also to inform the citizen that they need to comply the government regulation, therefore protocol, and then if they are comply, and then they can get the best result on this dashboard. So that's why we open this dashboard to give the openness of the information for the citizens also for operation and care. And also the comorbidity, also we also look for the elderly, and also the health protocol implementation. Anyway, we also working for the global certificate platform. So for the information, for the global digital harmonization for the digital certificate in the global, currently managed by Indonesia. So Indonesia as the president of G20, we are leading. So this is in Indonesia we need to proud that Indonesia is leading the integration of the digital health document for the COVID-19 certification, but also for the future pandemic. So we are leading for this process, and then we integrate all G20 countries platform into one single platform using the gateway to make sure all citizens, all travelers have an easy process to enter other country. So we are leading on this process, and we are currently developing the gateway and also managing the implementation on this integrated platform for the COVID-19 certification in the global. And you can see this is also when the Secretary General of the WHO come to Yogyakarta, and then the Secretary General see the platform that we are building about the integrated platform for the COVID-19 digital health certification platform. The important things about this platform is no any data exchange. So we are using the public key and private key mechanism to verify the certificate. So not all of the issue on the COVID-19 need to be solved with data integration, but sometimes that also need a very simple mechanism about the public and public trusted mechanism, so that we are exchanging is not about the data, personal data of the patient, of the user, but that we are exchanging is about the key to verify the certificate. So this is about the important, one of the example. Not all data integration is about the personal data record, but also sometimes it's also about the key transfer or about the other data transfer that's not relevant to the personal data. And quick information about this, our strategy about beyond the pandemic, that this is the vision as in the Ministry of Health in Indonesia. We want to develop about the electronic medical record start from the baby. So this is the key. Usually we get our medical record when we're getting adult. We're going to hospital, going to clinic, and then we get our medical record. And then after that, doctor asking, do you have any history on your disease or your condition? And then we don't have, because all of the document in the paper-based format. So this is the strategy that we are building. So we want to make sure from the baby at the early, we have the all health medical record based on the digital format. And this is also important aspect for the prevention, because we have the historical data in our medical record. And we already rolled out our strategy about the digital health information. Already published on the DPO that campus already. You can access the information in the website. So we're focusing about the two aspects. The first one about the data integration based on the individual, based on the personal data. Number A. And number B is about efficiency on the app, on the health facility. We don't want health workers working on the 100 apps every day. So when I'm visiting the primary care, I'm asking the nurse, how many hours you're working on the system. I'm working for inputting the system for the 5 hours. So the nurse working for the patient only 3 hours, but working on the system in the 5 hours. So the main responsibility of the nurse is inputting the data, not just the patient. So this is the issue that we want to solve about simplification. And the last one about the ecosystem, to make sure we have the ecosystem to support the digital health transformation using the regulatory sandbox, using the incubation process to support the policy and all. And this is the timeline, the quick timeline. In this year is about the development, and the next year about the implementation, and then the 2024 is about the expansion. And this is the platform that we are just rolled out last month about the Satu Sehat Indonesia Health Service. So what we are building is not bad. We only want to build one app for the citizen, but for the hospital, for the primary care, for the clinic, we need the support from the ecosystem to also develop the system, and then we build the platform to integrate all the systems. Just this is our strategy to integrate the data. We are not building the app, but we are building the platform to integrate the data, and also building the standard. So the data, all data standard, all of data store is standardized. So this is strategy about how we collect the data for post the pandemic. And after the data, all the data collected, and then will be shown on the citizen app or Peduli Lindungi. So if you can see currently Peduli Lindungi only for the COVID-19, but in the next following weeks or next following months, the Peduli Lindungi will be also extended for other health information, for the immunization information, for the routine medical checkup information, and many other information, not only for COVID-19. And then this is my last slide. And also the most important thing is about the open data. So we also want to make sure all data stored is also open for the public, but still always also considering about the data privacy. So that's why we also publish the data in our one single dashboard that currently in the development. So all citizens or people can see the progress of the government, can see about the result of the health program in government. Similar like the vaccination data that you see, but will be extended to other diseases also, other COVID-19 or other health information also. So this is how we also make sure we also support on the open data for the government. So that's all the COVID-19 strategy that we have by utilizing the data. Also our strategy, utilizing the data post the pandemic. So thank you so much. So let me know for any question or any feedback. I for back to the coordinator. Thank you.
Thank you so much, Oscar, for the presentation. It's amazing. You mentioned during your presentation, it's mind-blowing when you ask the healthcare professional, right? How much time they spend for inputting the data versus serving the client patient is like mind-blowing, right? They only serve patient for 3 hours versus 5 patient is inputting the data. It shows like so many inefficiency in the healthcare system that we have right now. And I'm so pleased hearing about that you are working toward the platform Satu Sehat, right? And where we can get all our medical record there, and also in Peduli Lindungi. So it will be launched next month, like for the other medical record. Is that correct, Mr. Oscar?
So the platform already launched.
Oh, sorry,
So,
launched. Oh, okay.
But the integration is still ongoing because we have 1,000 health facilities for to integrate in the platform.
Oh, okay. That's awesome. So I'll that it. So no need to look like where my medical record, everything is gonna be listed there, right? From all the medical facility. That's amazing. Okay. I have a few questions that I want to ask you. Like, is there any problem in collecting the data, especially like from like public general audience, citizen of Indonesia, right? Who have limited understanding what is data, what is the use of data, what are the challenges in data collection?
Yes. So we need to define a bit challenge in our side. The customer is to group. The first group is about the health facility workers, right? And the second group is about the director to the public or the customer or the patient, right? So we have the challenge in the both group. In the first group, yeah, about the health facility. The most important challenge is about the standard three aspect: the digitalization, standardization, and facility integration. So that's for the health facility. Most of the health facility is still not digital, or except for the pharmacy unit. Okay, if they're digital, they're not standardized.
True.
They develop by their own standard. And the last one, if they're digital and standards, but they're not integrated with our platform. So that's a big challenge, yeah, about integrating with the health facility group. But for the patient side, there's also a challenge is about to make sure they get the benefit when they submit their data. Because sometimes citizens like confusing, like where I need to report my data, for example, like that. So this is the key that we want to put all back. That, okay, if the data from the patient, we need to give back the services to patient again. Because the data comes, so the data from the patient and then back to the patient. So that's the concept that we want to put, that the data is owned by the patient, and then also the patient have the rights to get the services based on the data. I think that the information is opportunity.
Okay, thank you. Yeah, I think that's a true challenge, right? In data, the problem is data is not standardized, right? And I still remember, like when I go to doctors, most doctors they're still using paper, right, to record my medical record. It means like they really right now need to digitalize that that write-up of my medical record, right? Otherwise, we will not be able to capture that information. So in your office, what do you do to incentivize like the medical facility to make sure everything is digitalized?
Yes, in our strategy, but to make sure our health facility is digitalized. So the first important aspect is about the improving the ecosystem, right? So we have 60,000 health facilities, 60. And I think half of the health facilities is still not digital. And if it is solved by the government, that's not possible. So the most important solution is about involving the stakeholder, involving the industry, the startup, to support us on the digitalization. So this is also usually I am talking about this, like we invite all industry, all startup to help us on the digitalization of the health facility. So the market is there. Yeah, the market is there. You can have the business with the health facility to provide them the system. That's fine. We really did it like that. So we push to the industry. We have the market, but no one see on this market about the health facility that's not digital. And then if you want to collaborate, if you want to have business with the health facility, that's fine. We need that. So you can support us on the digitalization. That's what's fine. But if you digitalize the health facility, you need to follow our standard. So as regulators, we provide the standard. We provide the policy. So to make sure all digitalization in the same page, right? And the last one, if you are using the standard, your system needs also to integrate to our platform. Satu Sehat. Why? Because we want to make sure when you have the system, the data collected to your system is also integrated into the Peduli Lindungi, so the patient can get the benefit. So that's the strategy that we have. That we want to make sure that the industry also supporting on this mechanism, and also industry have the market on that.
Okay, thank you, Oscar, for the explanation. I will speak in bahasa to recap it. Jadi strateginya ini ya, correct me ntar kalau saya salah ya Pak Oscar ya. Jadi strateginya pertama ini bekerjasama dengan industri, karena terlalu banyak ya Pak ya, medical facility terlalu banyak. Kalau kita nggak dapat bantuan dari industri, dari startup untuk bantuan digitalize, itu is impossible mission gitu ya. Jadi gimana caranya supaya jadi mission possible, ini kita butuh bantuan startup. Jadi bagi teman-teman yang hati tergerak atau punya ketertarikan untuk di kesehatan ya, bisa bantuin ini untuk gimana caranya kita digitalize medical record yang dari paper, yang dari kertas-kertas itu digitalize semua ya Pak ya. Dan itu potensi banget sih. Cuma kita harus pastikan waktu kita digitalize itu sesuai dengan standar dari Kemenkes. Nah, kalau udah sesuai standar, itu tinggal terintegrasi dengan platform Satu Sehat. Jadinya semua datanya terintegrasi di sana. Jadi bagi teman-teman yang mungkin mau cari mungkin peluang bisnis atau ingin bergerak terjun di bidang data, ternyata ketertarikan bidang data, ini waktu yang tepat karena ini kita lagi banyak butuh bantuan ya untuk digitalize medical record. Itu mungkin sedikit recap ya dari tadi jawaban Pak Oscar. Bagi teman-teman yang mau submit question, go ahead, bisa submit di Slido, bisa dalam bahasa Indonesia or in English. Oke, kita tunggu ya teman-teman untuk submit questionnya. Mr. Oscar, I have like another question to ask in regard to, this is getting very interesting, like digitalization, integration of all medical records, right? So another question that I have, like how your Minister of Health working together with other ministry in using the data to tackle the COVID-19. How do you guys work together?
Yes. The data integration is actually that's the most important aspect with the COVID-19 response, because not all the health data is produced by the Ministry of Health. For example, we also have the data from the claim system from the BPJS, right? We also have the data from the medicine pharmacy, from the pharmacy unit. And so the important aspect also about to have the data about the target of the vaccination from the Ministry of Home Affairs, right? So we are working together with the other ministries to make sure that the data integration is there, and also no any obstacle to solve the COVID-19 pandemic because of the data. Because yeah, we want to make sure that that the customer, that the citizen knows that the government is working together to solve that issue, not like having the silo. But also the interesting aspect is this COVID-19 pandemic showing the importance of the collaboration, right? Before the COVID-19 pandemic, each of the ministries still in the silo program. They want to integrate the data, but because of this COVID-19 pandemic, and then we are all of the ministries realize that we need to work together to solve the COVID-19. I think that's the
Okay, thank you, thank you. So the key is collaboration, right? The collaboration with other entities like BBJS and other institutions who in handling the COVID-19. Um, Another questions that we have, like, what do you think about application of Peduli Lindungi? Obviously, that's the one that we always have to use, right? When we enter the mall, we have to scan it, or whenever we enter public places, we always have to scan in, right? Check in. Is that working according to your expectation, or is there any like problem or challenges in the application of Peduli Lindungi application?
Yes, actually, this is working for my explanation. So I thought the story behind the Peduli Lindungi. Yeah. So the Peduli Lindungi actually, I have the concept of this communicable disease mobile app application since 2014. So you can search in the Google, right? My name, Daniel Oscar Baskoro, and also see search about the health symptom. So I already designed about this concept about the mobile app based for the communicable disease since 2014.
Oh, wow.
And on that station, yeah, we designed the app, and also we also invited by Google to Silicon Valley for at the moment. I still in the Gajah Mada University, and then the Google see this a very important opportunity to solve the issue for the pandemic for the health aspect in the US, not that in the US. And then when I back to Indonesia, no one looking at my app because no one saying the health app application, health sector application is important. So the 2014, like, why you care for the health sector? When I pitched to the investor, no one cared.
Oh.
On 2014, no one cared about my app, about this one. And then this is the, and then 2020, when I back from the New York, back from New York, and then that the COVID-19 happened. And then when the COVID-19 happened, and then I built up again my app, yeah, because someone there, my colleagues asking, you should build up your app again, because this is that we need in Indonesia. And we built the app only 2 weeks or 1 or 2 weeks, yeah, because we need to have that solution part, and then getting viral. On the first week or 2 weeks of the COVID-19 announcement, getting viral. So everyone reporting my on the TikTok. The name before that, the name was not Peduli Lindungi. And then after that, and then I'm invited to Jakarta for the central government to build this Peduli Lindungi also. And then we are building the app, and then guarantee used by the 100 million people. So that's a long time for the people to realize about the importance of the app. 8 years actually, 7 years, yeah, from 2014, and
Right.
yeah, and then now we're working for the COVID-19 response.
Oh wow, that's amazing story.
Yeah.
So you're actually 7 to 8 years ahead of like when people realize that they truly need it, right? You already built it. Google apparently like notice it and they recognize the need and use it for your ads. Indonesia, they haven't paid attention to it until the COVID hit, and now all of a sudden it becomes very critical app, right? Everybody right now need it. Wow, that's amazing. So you're the guy behind our application Peduli Lindungi. Wow.
Yeah.
That's amazing story. Never know it. Oh wow. Okay, I think we already got some questions also from the audience. So let me read a couple of their questions. Let me see. Okay, so the first question is Peduli Lindungi is obviously has the data from the whole Indonesia. How is the data security policy and system there to avoid any data leakage?
Okay. So about the data security concern as a data security aspect, we always comply with the standard of the data security aspect and also the data privacy concern. So we put all the data and also the infrastructure based on the standard of the privacy aspect, standard of the security aspect, to make sure we deliver high quality services for the citizen. Because the important things about the COVID-19 pandemic response also is about to make sure the app can work for the COVID-19 response service for the service for the COVID-19 response also, but also having to make sure the data is safe, secure beyond the pandemic also.
Recently, sorry, following up on it, there's if I'm not mistaken, litigation about data privacy. How do you respond to that? Like,
so actually, there's not a legal issue on the data privacy. This is only the understanding of the citizen, because when you see only one sentence and I'm not seeing about the technical aspect, and then you are missing the information. So we always explain that you only see about the one sentence about that, but if you see the technical aspect, all same. Because usually that in the technical aspect, from the technical aspect or the programming aspect, that will be very difficult to explain to the citizen, right? Yeah, right. So I call, for example, this data security aspect using the ISO 2007K series. That's the data security series for the standard there. And then the citizen always asking, if it's we're using the standard, and then what kind of standard in the 27K? Many standards on that, including to protect one aspect of the data security. So that's the answer. So no any data, right? But the citizens or the people need to get a complete information about the technical aspects, so they can get the point on that.
Yeah, there's always a concern for general citizen, including me. Like every time, like let's say I check into the mall, right? I have to scan the app, right? I always be on the back of my mind, like, so am I being tracked wherever I'm going? Like, no, that's something on the back of my mind. Like, but if you say that it's actually the app, but they already like follow the standard security, and you assure that there's no leakage, there's a data privacy, then we can have a peace of mind, right, when using the app.
Yeah.
Okay, that's always a concern. So this is also another question, like how platform Satu Sehat data to be kept protected from illegal authorities and not being used illegally by unauthorized body.
Yes, very interesting question. So this is about the important aspect about the role management here, right? So we put the role management on all of the system. So if you see in the theory of role management, there's a super admin, there's an admin, there's a level role for the province level, for the national level, for the city level, for the puskesmas level. Each of the level have their privilege system. So we put the role management as a key aspect also for protecting who have the rights to access the data. So that's the basic mechanism how we protect the data from the other party or some or people that prohibited to access.
Got it. So in short word, it's safe, right? There's a certain precaution being made, right, to make sure the one illegally used it, right? Okay. Another question that we have. The tracking system for COVID is thoroughly set up. The question is how fast they would cover the whole Indonesia. Does the system cover Indonesia in rural area?
I think the military plane.
Okay, let me repeat again the questions, or maybe I copy it to the chat. Give me a second.
Okay, That's right. You can, yeah.
Okay, the tracking system for COVID is thoroughly set up. The question is how fast they would cover the whole Indonesia. Does the system cover Indonesia in the rural area?
Yes. So the COVID-19 tracing system is already up here. So we already covered all of the area in Indonesia in the village level. So not only for the tracing system, we already covered around 10,000 primary care. So I think almost 98% coverage on the village level since last year, since August, since we integrated data. So I explained in my slide, yeah, we integrate the data from the mining aspect and then build the tracing system, collaborate with the military, with the police, with the health workers and the volunteers in the village since last year, August last year, and then currently serve around 10,000 puskesmas, so around 10,000 villages in Indonesia. So hurry up. So we have a very comprehensive tracing system. Our ratio for the tracing is 1 to 15. So 1 case for the COVID-19, and then we need to get 15 close person or 10%.
Okay.
Yeah.
Okay. So 1 to 15, and that's already according to the standard, right? From the WHO.
According also, I think also offer that. Also offer the standard because
Oh, it's over the
usually-
standard. Oh,
for example, 1 case usually like if the one person like only meet 2%, yeah, every day, and then yeah we push the stuff usually to find 15, but yeah something like that. So because yeah usually we met person like 1 to 5 years. So especially for the elderly people, right? Elderly people, they all or children also. They only meet 1 to 5% every day, but we push that the stuff you need to find 50. So like when the patient or for the positive case going to the supermarket, going to the public space, we need to also the trace, not only for the family close to the positive case.
Okay. Okay. Yeah. So I just wondering, like, before and after Peduli Lindungi, like when you first implement it, maybe you can share what are the challenges and what is the direct impact of the usage of Peduli Lindungi to tackle the COVID-19.
Yeah, especially about the direct impact is about the health protocol. So before that, we cannot manage and also we cannot control the citizen because we don't have the system to manage that to make sure the citizen comply with the health protocol, the public space comply with the health protocol, and many other sector comply with the health protocol. Industry also comply with the health protocol. So by using the Peduli Lindungi, we can make sure that citizens having the have to comply with the health protocol, and then that the result is about to stop the spreading of the COVID-19 disease. Yeah. So that's the important thing. And also the second thing is about to make sure the good services for the patient. Before that, we are difficult, for example, to make sure each of the patient is get health services. So, for example, like this. Before we integrate the data for the telemedicine, when people get the positive result in their lab and then they get panic and then they go to the hospital, going to hospital, right? And then they go to the hospital with getting very busy, very crowded, and then the system will be very difficult on that situation. But after that, the people feeling they're safe because government is responding to the result by giving the telemedicine services, by giving the medicine, and then they can feel safe when they in the self isolation. So just the also the result, yeah, to make sure the health facility not getting crowded and getting difficult because the patient feeling safe to have such isolation in their homes. I think that's the two aspects that we're moving on.
Right. That's I still remember back then. I think last year, right? When I think the worst one is when Delta hit. Oh my,
Yeah.
that's we really feel like the advantage of having the application Peduli Lindungi, right? Uh, we don't really get it in Surabaya, but I know in Jakarta areas like they're able to get telemedicines, right? Right away after they get positive, right? Because it's so hard to find the medication at that time. Like we are trying to scramble finding from
Yeah,
one
yeah.
pharmacy to another pharmacy. Yeah.
Yeah, so we starting the telemedicine is only 2 weeks, yeah. So when the Delta hit Indonesia, yeah. So
Mm-hmm.
the case getting this, and then I'm working together with my team, yeah. So working very fast to make sure the integration and many other aspects. And then yeah, that's when not Surabaya. I think the second phase in the 1 month after we roll out, but starting in Jakarta first, and then in the July around July early July we roll out in Jakarta, and then in the next following weeks, in the after 2 weeks, and then we roll out in other province. But currently serve most of the big cities or big cities in Indonesia for the telemedicine and also the free delivery medicine.
Oh wow! So this is the good news for us who
Yeah,
live not in the Jakarta or Surabaya, right? So
yes, of course.
okay, good to know that. So next time when there's some pandemic hit, we still can get access to the medication that we need, right? No need to rush buying, right?
Yeah,
Like people rush buying at that time and crazy like some medication it could be like hundreds
yeah.
millions of rupiahs. It's yeah ridiculous pricing. Okay. Another question that we have. The question for the audience, Mr. Oscar, regarding digitalization, the health worker has to be well literate about the tech. As we know, in rural areas, the literacy is still low. How do you think about it?
Yes. So that's also the big challenge here. Like because I feel the military answer
Sorry, your voice is not very clear. It's
because the noise because of the military airplane.
oh
So
okay,
because I close to the airport of the military so because
okay, sure. Okay. While we
my
wait,
voice,
like
can you hear me?
yeah,
Okay. So
yeah,
yeah,
we can hear you.
okay. Yeah, one of the solutions that we built is about building the digital health workers. So we combining not only the health workers, but also we develop new terms called the digital health workers. Or we call it the digital testers,
Digital what? Sorry.
digital health workers,
Oh,
health
digital.
workers,
Okay.
okay, or digital presence. So this is to complement about the limitation of the knowledge, yeah, from the health worker. So during the tracing station, that's we roll out that terms, yeah. So okay, so we put one young people in the health facility in the primary care to help the health workers to input the data. So health workers can still focus to serve the patient.
Oh.
So the health workers and also military and also the police can focus to trace the patient during the COVID-19, right? And then after that, they back to the primary care. And then in the primary care, we provide the young people that help them to submit the data into the tracing system. So we are a little bit afraid that the mechanism not working yet. But after we roll out, yeah, in the tracing mechanism and then the mechanism work. So we solve the issue about the data literacy by combining the young people that advance on the digital literacy, and then they're working on the data input, the system input, and then health workers and the pros focusing on that health services. So that's the mechanism that we are providing. But for the long term, we are currently also having the strategy to build health informatics curriculum, yes, for the primary care level, for the village level. So the village level can also understand about the health informatic knowledge. We start to roll out some training, some mechanism to give the knowledge on that for the long-term solution.
Got it. Yeah. So combining between young people who's more have a knowledge of the literacy with the medical, right? Because
Yes.
people, so that they can still use the technology. Yeah.
Correct.
Totally agree. It has the big combination of the two. So I have a question also, like as a citizen of Indonesia, what we can do, like what we can help so that obviously we achieve the goal, right? Having digital transformation in healthcare, everybody can access like their medical record in the platform Peduli Lindungi. Down the line, everybody has a better knowledge of data literacy. What we can do.
Okay, so I'm talking as I will give the answer from the group of the audience. Yeah, the first group is group of the startup, group of industry. So the first group of the startup industry, the government, really needs support, collaboration from the industry to digitalize 60,000 health facilities. We have 60,000 health facilities that's still there and still not digitalized. For example, I will give the detail. 10,000 primary care. So 30,000 is pharmacy unit, 3,000 hospital, around 10,000 clinical, and also 3,000 laboratory. Yeah, I think the total is already 60. So we have 60,000 health facilities that still not digitalized. If they're still already digitalized, I think most of them are still not standardized also. So the opportunity is there. The business is there. I to the point. The business is there. Yeah. So if you can digitalize that health facility, you get the business, right? And also you can support the government program, right? Then let us know for any support that you need to digitalize the health facility. And then we will provide. If you need the regulation, need the standard or something that you need, let us know. We will be very open on that because we need a lot of support from the industry, from the ecosystem to support us on the digitalization on the health facilities. If I can give an example, for example, one startup can serve like 50 health facilities, or so we can have like challenge because we have 60,000 and then it's of the startup. Okay, I will working for the 50 health facilities in the Surabaya. I'm working for the 105 health facilities on the Kalimantan. So this is the market. If you're not going to the market right now, and then you will miss the time because not anyone realize about this market. And I explaining market, and then if you're not going into this market as soon as possible, and then you will miss the market. We have 60,000 health facilities for the market for digitalization. That's the first one for the group of the industry. And the second one is about the citizen. So the citizen, just quick thing, that we want to make sure that we're focusing not only about the curative but also the prevention. So please, because this topic is about data, right? Please, government will provide data of your medical record after the situation, and then we suggest for the citizen to use data, starting from your side, starting the data from the medical record. For example, if we give your data about the medical record about, you have a high cholesterol, for example, you need to prevent yourself, right? Yeah. Don't thinking like, I can go to hospital when I'm getting sick. No, don't think like that. Starting from the prevention. Yeah? So if my mother was told that, I was like lebih baik mencegah dibanding mengobati. So we need to go on that, and then the most important thing we can prevent by using the data that we provide from the government. So I think there's two aspects here that I want to emphasize about the support from the ecosystem industry to digitalize the health facilities because the market is there. Don't miss the market. And the second one, the citizen need to start to use the data for the prevention aspect, starting from the citizen itself. So I think that's the point.
Thank you, Mr. Oscar. So let me recap in bahasa because this is very important. Dari industri kita bisa mengambil kesempatan ini ya, yang di mana kita bisa membantu digitalize 60.000 medical facility provider di seluruh Indonesia. Ini kesempatan yang besar. Kalau mau butuh informasi lebih lanjut gitu, Mr. Oscar, tanyanya ke siapa, Mr. Oscar, terkait apa aja yang dibutuhkan, standarnya apa, itu kemana, Mr. Oscar?
Bisa email directly ke email kami di website dtto.kepkes.id ya. Itu ada informasi kontak yang bisa dihubungi. Nanti juga bisa ke DM Instagram kami juga respon juga cukup cepat di Instagram kami ya, dtto.kepkes. Ya, seperti itu biasanya kita menggunakan kanal-kanal resmi aja supaya nanti bisa ke-tag. Kalau misalnya di kanal pribadi kadang-kadang kelewat, malah sayang sekali kan.
Iya, paham. Jadi bagi teman-teman yang mungkin lagi mau bangun bisnis nih ya, ini salah satu peluang. Jangan Mr. Oscar bilang jangan kelewatan, bisa langsung ke IG ya, atau email Digital Transformation Officer Ministry of Health ya, Kementerian Kesehatan. Yang kedua, kita sebagai citizen ya, kita juga harus jaga diri gitu ya, jaga kesehatan kita menggunakan data yang udah ada. Jangan kita makannya sembarangan kalau udah taunya high kolesterol ya. Jadi sama-sama menjaga diri sendiri ya, menjadikan Indonesia sehat ya, Mr. Oscar. Oke. So mungkin ini cuma mau tanya last word ya, Mr. Oscar, what is the last word that you have for our audience here this morning?
So yeah, thank you, Alisa. So thank you for the today discussion. So when we're talking about the topic of the data, the most important thing is about digitalized work. If we still have the information still in paper-based format, so no one can analyze the data, no one can integrate the data, right? So the most important thing about digitalize the information and then become the data that we can use, we can integrate, and then we can utilize for purposes. So we invite all of the stakeholders, invite all ecosystem to support the government program to put all information become digital, become the data, become the data. And by digitalizing the health facility, that's the important thing, the first one. The second one is about to make sure if we collect the data, we integrate the data, if the data the important thing need to be used. And then because if data only collected and then no any benefit from the data, right? So the data need to be used by the policymaker, by the individual. So this is the important thing. The data need to be used for the decision making, not only collected, but also we need to use the data for any decision making, especially for the health. So just to last sentence here from me. So thank you so much for the invitation. I'm looking forward for any discussion of communication via email via the official email for the DTO. Or you can also contact me on my Instagram also if you want to discuss directly with me. So my Instagram at OscarXP if you want to discuss with me personally. So thank you so much.
Thank you so much, Mr. Oscar. So for sharing your knowledge like about the digital transformation, what you did, especially through application Peduli Lindungi, and your word of saying that we need to digitalize the content, right, and use the data, right? So saya ngomong dekat di bahasa, jadi kita perlu satu digitalize ya. Kalau kita punya informasi masih di paper, gitu ya, di kertas, harus semua dimasukkan ke format elektronik. Yang kedua, jadi kita harus mulai menggunakan informasi. Jadi ngambil putusannya nggak lagi on feeling, tapi based on data, gitu ya, Mr. Oscar. So kalau ada further question bisa langsung DM di IG-nya Mr. Oscar atau langsung email di DTO. Itu sekian dari saya. So thank you so much, Mr. Oscar, for your time, for sharing with us this morning. So I'll give it back to Celine as our MC.
Thank you, Mr. Oscar and Ms. Lita. Wow, what a very informative seminar from Mr. Oscar. All right, ladies and gentlemen, we have reached the end of the first session. Before ending the session, let's take a picture together. Please, the committee, to help us to take the picture. Okay. All right. Kindly reminder, we still have another session at 10:45 a.m. the Western Indonesian time. Don't miss out the other enticing session. If our first session discussed about using data analytics in healthcare, our second session will discuss best practices for data management and governance, which you will definitely need to take advantage of data analytics in your industry. So see you in the next session.